Welcome to our panel, The Need for Healthcare Reform, The View from the Union Hall. This panel is not only part of the 2022 Medicare for All Strategy Conference, but will also be the next episode of the podcast Class Matters. My name is Katherine Isaac. I'm the Executive Director of the Debs-Jones-Douglass Institute. We work with a variety of unions to advocate healthcare reform and also produce the Class Matters podcast. Today, we're going to be hearing from 3 union leaders from around the country on the need to reform our healthcare system to control skyrocketing costs, make employers pay their fair share, and take healthcare off the bargaining table. So let's get started with introductions. Our first guest is Richard Hooker, Secretary Treasurer and Principal Officer of Local 623 of the International Brotherhood of Teamsters in Philadelphia. Welcome, Secretary Treasurer Hooker. And can you just tell us a little bit about your local and the members you represent?
So thanks again for this opportunity. It's good to be here to talk about this major issue. It affects all working people, every class, every race. So just a little bit about what we do here at Teamsters Local 623. We represent UPS workers and Greyhound workers, tickets, baggage, and maintenance. We've been doing this for a long time. The local was founded in 1909, and so we're just looking forward to having a great discussion about how we can change the way healthcare is done in this country. Thank you.
Thank you. We're also pleased to welcome Katie Murphy, President of the Massachusetts Nurses Association. President Murphy, can you please tell us a little bit about your members?
Thank you very much. It's wonderful to be here on this panel today. I'm the president of the Massachusetts Nurses Association, and we represent 23,000 healthcare workers and nurses across the Commonwealth, from school nurses to hospitals to visiting nurse associations and group homes. And we very much look at the healthcare disaster in this country from both the each side of the bed rail, from the patient side and from the provider side. So I'm looking forward to a great conversation.
Terrific. Thank you. And also welcome to Juan Ramirez, Vice President of the United Teachers of Los Angeles, American Federation of Teachers. VP Ramirez, who does UTLA represent?
Well, thank you for the invitation. We represent 35,000 members in Los Angeles, which includes the teachers, the nurses, the psychologists, the counselors. We go from early education all the way to adult education, and that makes up the 35,000. We are affiliated with the AFT and the NEA, so we are a merged local here in Los Angeles. We've been around since 1970 here in LA. So I'm glad to be here because this is an important issue that we need to find a solution to.
Great. Well, thank you all for joining the panel. We know that most Americans get their health insurance through their jobs, and workers fortunate enough to be union members often have some of the best available health insurance coverage in the country. But the average annual premium for employer-sponsored health insurance is now more than $22,000 a year for family coverage. That's an increase of more than 4% over the past year, according to the Kaiser Family Foundation. And premium costs have increased 22% over the last 5 years and 47% over the last 10 years. That means a continuing demand from employers for workers to forego pay raises, to contribute more to premiums, and to out-of-pocket costs like copays and deductibles. So with that, let's get started with our first question. Health insurance has long been a major focus for unions at the bargaining table. The pandemic has certainly impacted those bargaining priorities. But for your unions, does healthcare coverage still rank high on your list of priorities? And second, what are some of the ways that employers try to push the increasing cost onto workers or to take benefits back altogether? So, Secretary Treasurer Hooker, let's start with you.
So in our collective bargaining agreement with UPS, That is one of the, if not the top priority in all of our negotiations. In fact, in 2013, there was a switch in healthcare. We had what was called a Cadillac plan. And so what the company did say, you know what, we're not going to provide that anymore. You're going to have to take another plan, which is called Team Care. Now that plan was, we got less coverage, but, and it fell on the backs of the members. And so whenever the company can use that bargaining chip over the negotiating with the union, it's going to be a problem, because what happened in 2013, the company and the union, they forced a contract on us because of that whole hair care situation. So it's a big problem for our union here. Healthcare is a major issue. It will always be an issue, and that's why this discussion is very important, so everybody can see the importance of Medicare for all. Take that bargaining chip away from the company. We have to take it away, because I know my other colleagues here, they will tell you the same thing. We do not want to be held hostage for healthcare. Our members should not be held hostage. They're already giving you their labor. Don't take their dignity too.
Thank you for that answer. How about Vice President Ramirez?
Yeah, I totally agree with Richard. Healthcare in LA is like the top issue we have. I mean, this is where our members will be willing to walk out if we would lose this the healthcare. Typically, I mean, the one thing that we do a little bit different here in LA, the district works with 8 different unions, and we set up this group called the Health Bargaining Committee, where they deal on how to make sure that everyone stays insured, and to find a better deal with insurance. So it's been in place for quite some time, and we found a way on how to keep it working at a minimum expense. But even then, now it's over $1 billion a year to cover every single employee at the LAUSD, which it's always the district every time it's time to renew our contract on healthcare. It's always the conversation. They want to increase start. They want the members to contribute, which, by the way, now we don't contribute anything. It's everything paid by the employer. So it's we want to keep it that way. But every time it comes to the table, that's like the first thing. It's so expensive, and we get that it is expensive, and it keeps going up. But we always push for them to find a way to keep maintaining the healthcare. And again, the plan that we have, where we have the 8 unions working together, working directly with the insurance companies, we have maintained the lower price, but even then it is expensive. And so I agree with Richard. I mean, if we didn't have that, imagine all the good things we could do for our workers. But it's something that it's eventually we won't be able to sustain, because as time goes by, prices go up. I mean, right now we're able to control it, but it will be impossible to sustain in the long term. Thanks.
Thank you. And how about you, President Murphy?
Thank you so much. I do hope you can hear me. Like so many of these discussions, paying for health insurance today is very, very complicated. And I did say it that way, health insurance as opposed to health care. It's
Right.
insurance. And and as union members, we negotiate this with our employers. And just as my colleagues have said, this is a huge issue at the table. We're a majority female profession, and we very often carry the insurance for our families, and we often have families that are young, and we have a lot of differently abled family members. We cannot afford to be without health insurance. And in surveys of our members prior to starting negotiations, health insurance premiums are on the top of the list. And a jump in premiums can put a member in a tailspin. More than one nurse has told me that he or she has had to get a second job to pay for their health insurance premium. That's how big a jump has been forced upon a member by the employers. And I'll make a note that when the M&A nurses walked out of St. Vincent's Hospital last March in a legal strike, they lost their health insurance on that day. So now these were family members, children, and nurses without any access to health care whatsoever. Kids couldn't get tests they needed. They couldn't get insulin. Family members that were undergoing chemotherapy, all of that stopped. And that's a blow to every worker in the United States. And we also find that linking health insurance to employment is bad for Americans across the board. At the table, what we need to be addressing is work conditions, benefits like pensions and paid time off, and wages. And the threat of higher insurance premiums knocks those issues way back down the list. And what we think? We think that the employers really don't mind that. We feel that getting it off the table, instituting a Medicare for all system benefits all of us.
Great. So it's not only that the employers push back, but it can use it to prevent a strike, right? Because it's really difficult to go out on strike without or knowing that you would lose your health care benefits, right? So, and then just for all of you, you mentioned it a little bit, but what's the impact on wages? Like, how do you ask for a wage increase when the healthcare costs are going up? Just any of you want to take that?
You're right. That's going to be very difficult because the employers, first they're going to say, well, we're giving you all this money in your health care. We don't have enough for your wages. Pensions are very important as well. Well, we don't have enough money for your pension now because we're giving it all to you in your health care. So it demands that the negotiators go back to the members and say, hey, we can't get you more money in your pension. We can't get you more money in your wages because of the healthcare costs. And that actually happened to us last negotiating cycle because our previous administration told us, hey, if you guys don't take this right now, you're not going to get those increases in your pension because this is the cap that the employer is going to play. This is the cap they're going to do on this. And if you don't take this, you're stuck with it. And again, if you take it off the table, you never have to hear that again.
Mm-hmm. They really do use it as a threat. You're exactly right. And I think we all see this in our negotiations, right? And I have had members come up to me and say, whatever happens, please don't increase my health premiums each week. And so maybe they'll get a small raise, but that in the premium will be going up, which just totally negates the raise. So it's a shell game.
Yeah, for us, it's been years that we go without a raise because of that. Mm-hmm. So we just sometimes we go several years, and we've done that in order to maintain healthcare. So totally agree with Katie and Richard.
Right, and the cost of living is increasing.
Right.
And our members need those raises, right? As everything's increasing, and families are needing more and more, and we're just not seeing that. And I think we also find that in order to maintain, as you're saying, and I do know of unions as well where the members aren't paying anything, and in order to maintain that, then the discussion of working conditions, shift work. They try to take a holiday away, everything we're trying to do to make conditions better. Or, I'm sure you're having exactly the same issues when we're trying to talk about making sure that we have enough workers on a shift so that it's safe, so that children and workers are getting the level of attention they should be getting. We can't even discuss that because we're discussing the health premiums.
Right, pretty much everything revolves around healthcare.
Yep.
At the table. because they know
Right.
it is very, very important, and they know our members need it, and they know they most times they work at the job because of the benefits there, and they know that the employers know
Right.
that,
They do.
and so that's what we got to take it off the table.
And I think we're finding, I don't know if you're seeing the same thing in your unions, that hospitals where our members are consolidating and saying, all right, we're only gonna raise the premiums a little bit this year, but you have to only come to our hospital or our network, which really, if you have an illness or something or an issue that can't be treated there, then you're going out of network and you're paying out of pocket. I don't know if your members are running into the same constraints, that now it's forcing people to, go to the hospital system where they work and they can't go anywhere else.
Well, we're not there yet, but one of the part of the plan that we have is that we have lifetime healthcare.
Mhm.
So I mean, the fact that I'm still at the district and many people have remained in that district is because of that, because
Right.
we want the lifetime healthcare. But it's always one of the things that, like, the first thing they'll come and say, I think we're gonna have to let that go because it's just too expensive to maintain. But it's interesting how they'll try to find ways to try to get back and make some cuts because of we have that issue with healthcare.
So it gives employers just a massive bargaining chip, right? Yeah.
Yes.
So let's move on to the second question. There is fairly broad consensus that our healthcare system is in crisis and in need of reform. One of the options on the table is a single payer system, or Medicare for all. It would replace private insurance with a more generous version of Medicare, covering everyone and eliminating premiums, copays, and deductibles. And what I'd like to ask you is, what brought each of you to the conclusion that a single payer system like Medicare for all is the best path forward for your members? So let's start with you, President Murphy.
Thank you. It's so think about this, because it was a long time ago, but more recently, 2 years ago, at the start of the pandemic, I looked around at all of my patients and I looked at the names, and it was Rodriguez, Diego, Cruz. Not unusual for an urban medical center, but unusual for mine. And almost 100% of our patients were Latinx, which really was a red flag for me, because that's one thing that said to me is part of our population is being affected so unfairly. And, it's the vulnerable, and those with less access to healthcare, or as we saw, the frontline workers who couldn't afford to work remotely, were affected so profoundly by this pandemic. But many, many, many years ago, and this is just a quick story. I was a fairly new nurse, and I was taking care of a patient. I'm just going to call her Anne. And Anne had high blood pressure, wasn't very old. She was about 40. But she couldn't afford her blood pressure medicine. So she was cutting the pills in half, and she was cutting the pills in quarters. Blood pressure medicine, as you well know, doesn't work that way. And she had a massive, massive hemorrhage in her brain that was catastrophic. So I spent the entire night in my ICU while the donor services organization looked all over New England to place her organs, because Anne and her husband had selflessly offered to donate her organs. It was this catastrophic bleed. Now, how many hundreds of thousands of dollars did that cost? Now, granted, many people got to live through her generosity, but for the cost of a pill that Big Pharma pays, can make 100 or 1,000 for a penny, that this person had to lose her life. These are graphic examples of the incredible, incredible disparities of a for-profit health system. you can't call it a health system. You have to call it, somebody in a conference called it a health chaos. But it made me realize that really in this wealthy country where we're paying so much for health insurance and having such terrible outcomes, where people were losing their lives. And I see people lose their lives on a regular basis because they don't have access to health care. And the pandemic highlighted that and exacerbated that, even though I came to MassCare, which is the umbrella organization in Massachusetts, a couple of decades ago. We can afford to do much better. When we have models all around the world that I believe with American ingenuity, we can do even better. And we have the ability and the smarts to implement a Medicare for all, where everybody gets all the care he or she needs. And we would save billions of dollars at the same time. So I think you can't work in healthcare and not see the terrible waste and the terrible loss of life. And we have the ability to do something about it.
Thank you. How about you, VP Ramirez?
Yeah, well, the work we do, organizing our teachers and our communities, we realize that, we are so fortunate that we do have healthcare, but our communities don't. And this lack of insurance for the community, it has created a culture where people don't go to the doctor unless they really need to be there. By the time they get there, it's either very expensive, and it's like something that it's so bad that they really can't do anything for them. So I think to change that, we need something different. I spoke earlier how we won't be able to sustain the program we have because of the rising cost. On top of that, we have a large community in our district. We have over 1 billion parents because we have like 600,000 students. A lot of those parents, these are most are we have 70% Latino community just in the district, 10% Black, and then all the rest, all the other different type of ethnic groups that we have in LA. But many of them are lower income. It's a lower income community that cannot afford insurance. So I think we need to come up with a plan, a program that covers everyone, because we care when the student doesn't come to school, and that's because they were not able to take care of themselves in a preventive way. So we need to even change that culture, because it's not helping. And it shows when they don't come to school, when the communities cannot afford to go visit the doctors on a regular basis, and talk about the dentist and the eye doctors, so all that. And it's because we don't have a plan that it's sustainable or that includes everyone. So I think that's one of the main reasons we advocate for a Medicare for all, where everyone has the opportunity to take care of themselves.
Thank you. Secretary Treasurer Hooker?
So one of the main reasons why I think this is very important is we have an old saying in the South. I grew up in the South, is you don't really care about it until it happens to you.
Yep.
So, and to piggyback off of the previous question is about the employer and how much power they have, and you combine that with a streamlined Medicare for all single payer system. I have one of my members. Her name is Monica Murchison, and she has lupus.
Yep.
And lupus is very, very, it hits me to my heart, because I lost my mother to lupus back when I was 5 years old. And so she's one of my favorite members. And so she was terminated while she was going through her treatment from the employer. She was off the job for 4 months. And during those 4 months, she was on a list to get a kidney transplant.
Yeah.
She couldn't get a kidney transplant because she didn't have any insurance. So the employer had power over whether she lived or died.
Yep.
That's not fair. We live in the most richest country in the world. why is our healthcare jacked up like this? Why? And also on a personal level,
Yep.
before we got elected, I was a shop steward, and a lot of my colleagues know when you're a shop steward, you do have a target on your back
Mhm.
because you're trying to, be an activist on the job, get your members more involved. And so sometimes the company will come after you and you'll be off the job. And I often wonder what would have happened to me because my wife, she back in June of 2018, we got a diagnosis that there is no cure for, and they could have taken her out of here. So what would have happened if I would have gotten fired?
Right.
My wife wouldn't be here today because of the system that we have. Our insurance is tied into our employer. It shouldn't be that way. We should have the single payer system. We should have the Medicare for all because no employer should have that much power over their employees, whether they should live or die. And to me, it's just that simple.
Yep.
No employee should have that power. They don't have that right. You're already giving them your labor. They should not have that right to say whether you live or die. And if you have employers like what we have, that's a everyday thing. It could happen. They could fire you for whatever. And now you don't have insurance for you or your family. God forbid something happens to your spouse, your kids. They shouldn't have that power. They don't have that right to have that power, the way I see it.
Those are really powerful for reasons for advocating for Medicare for all. But of course, there are lots of people who don't agree. There are critics, and they would say that Medicare for all will be too expensive, that it will ration care, and that we'll never win it anyway. How would each of you respond to those conflicting claims? And I'll start with you, VP Ramirez.
You know, many years ago, in our local, that was a big concern because we had like a Cadillac plan. We had like the top of the line, and then we want to know more. But so when the idea came that why don't we have something like for everyone, like Medicare, people will say no. We don't. I don't want to lose what I have because I have like the best of the best. But as time has gone by, knowing that we don't have that plan anymore, there have been some changes. Fortunately, we're still not paying anything, but it's not the same coverage that we used to have like 10 years ago or 15 years ago. It has changed. And so now, and knowing that, and knowing that we're not going to be able to maintain even what we have now. Who knows what could happen 5 years from now? Uh, I think that people have realized that the best way is to have something that it's uh, well funded, well structured, that covers everyone. And because we all know, if every time that it comes up uh, at the bargaining table, we're able to, we have to actually do come out and be vocal about this and push back and really defend it, like if it's like for the most important thing there is for us. It shows that our fight is getting harder and harder to maintain or to continue this way. So I think now there's more buy-in, and this I highlight to my members. We need to think of the future. What could happen later on for the new people that are coming in? We want to make sure, because one of the options they often bring is, well, let's make like a two-tier. You guys keep what you have, and then the new people will get less. Well, we don't want that, and
Right.
and that's not the solution. So I think that's why I think there's an understanding now that having again a system like Medicare for all, it would be a lot something that we can continue and sustain for the future.
Great. How about you, Secretary Treasurer Hooker?
I agree with the brother Juan Ramirez, VP Juan Ramirez. I totally agree with what he's just saying. I mean, again, 2013, we had a Cadillac plan here. And 2018, the company said, well, we no longer want to pay that anymore. And so they took it. So again, what's to say in 5-10 more years, they're going to take something else.
Mm-hmm.
So we need to really focus on having the single payer Medicare for all system. That way there will be no changes. And the more people that's in it, the lesser the cost.
Right.
It's just like a collective bargaining. The more people you have contributing, the less cost it will be. So, and there's always going to be detractors. Well, I got this, I got that. Well, from what I see and from my position, I don't want the employer to have that power over our members, whether they live or die, whether their families suffer because you don't have insurance. I've seen a lot of members take discipline that they shouldn't have taken, but they didn't want their family to go out without health care.
Mm-hmm.
That's not a situation that we want our members to be in. And, the more people that's involved in this and contribute to this, the better it is for everybody. So I agree with the vice president, and we have to make this happen.
Thank you. How about you, President Murphy?
Such compelling words from my brothers here on the panel. I think that the challenges of discussing with our members are real, and sometimes they feel insurmountable. There's the message coming from the hospital industry and the insurance industry is, this is too expensive. We cannot afford it. You cannot afford it. And it makes our rank and file fear it. We say, we've got it through our jobs. We just can't risk losing it. When really, in reality, that's not the case. That's not the case at all. One of the professors at the University of Massachusetts in Amherst, were lucky to have him study it for, I think, a decade. It's Professor Jerry Friedman, and he has done an analysis of what single payer Medicare for all would save in the state of Massachusetts. And I think that he's looked at other states as well. And you can go to masscare.org and look for his full report. It's not terribly long, but Massachusetts would literally save billions of dollars, which means the state of Massachusetts would have all these extra dollars to spend on schools, safety, climate justice, repairing our ancient infrastructure. But the messages coming from the insurance industry are so powerful. Even just watching television, you see the ads. And I think that message puts a lot of fear into our members. We try to keep it on our agenda at the Mass Nurses Association. So I try to keep it in front of the members' eyes at all times. But I think we have a lot more work to do to get our members to understand that this is what we should institute. Again, to take it off the table, but these conversations are complicated and have to be had one at a time. And these days, that's not easy. But that I think that's our charge going forward, is to convince our rank and file members that this is the best thing for us, both financially and certainly, as my colleagues have noted, for people's health. And because then I think we put the pressure on legislators to make this happen.
Yeah. So to follow up with that for you, President Murphy, you represent nurses who have, of course, been on the front lines during the pandemic, and your union just ended a 10-month strike against St. Vincent's Hospital. What impact, we all know, we can all imagine the impact the pandemic has had on your members, but how has that changed maybe even their way of looking at Medicare for all, and how did that lead to the strike? Can you tell us a little bit about that?
That is very interesting, but I'll also note some of our strongest advocates have been teachers, and also our drivers, right, who have been on the front lines and been, I think, very righteous fighters for frontline workers through the whole pandemic. But that was I think that we, in the middle of the pandemic, after being at the table for 2 years, the M&A nurses at St. Vincent Hospital, we were up against Tenet, a Fortune 100 corporation, not a Fortune 500. I mean, they're way up there. They're an investment company. They're not a healthcare organization at all. They just happen to own some hospitals. They refuse to bargain in good faith. It was the middle of the pandemic. Situation in the hospital was really getting bad. It was bad before the pandemic. We didn't have the resources we needed, and what caused us to walk out the door was, and granted, healthcare was on the table, as we've been talking about it, but we were really saying to Tenet, this wealthy corporation, that we needed more nurses at the bedside, and we needed more resources to take care of our patients. Very, very simple, very easy to understand. We had the data. It was all evidence-based. We weren't asking for, a new SUV to drive to work every day. We weren't asking to never work weekends. What we were saying was, just give us the resources where we can take care of our patients. And Tenet would not deal. So, we walked out the door. I don't think any of us thought it was going to last 300 days. And as I noted, the minute those nurses walked out of the building, they were without health insurance. We fought very hard to get COBRA, thanks to our relationship with the Secretary of Labor, Marty Walsh, the former mayor of Boston. He really helped us out and worked with us, so our members were able to get COBRA during, as the strike went on for several months, when people, you can imagine, people had gone several months without paychecks. I mean, certainly we had a strike fund, but this was 700 nurses that were out. Right. The hospital tried to take back our unemployment and went after our COBRA. I mean, they were, they used every dirty trick they had to try, and it was union busting. This was all about labor and organized labor, and they were aggressive in that respect. And nurses were, I have to say, we had moments of pure terror, as I'm sure everybody can realize, without paychecks, without health insurance, and it did end. And so we were really scrambling. So that certainly was part of it. It's part of the conversation. But you can see that organized labor unions looking at that, and their members just might say, you know what? We're going to have to settle for less at the table because we can't risk being without health insurance for that length of time. So more, as my colleagues here on the panel have said, if we take that off the table, we take that tool away from management and allow us to work. When we win these good contracts, we win those for everybody.
Thank you. And congratulations on successfully ending the strike. I'm sure it took a huge toll. Yeah.
Thank you.
So on the Class Matters podcast, our tagline is, what would the country look like if it were governed by and for the working class? So let me ask each of you what our healthcare system, one designed by and for workers, might look like and what problems it might solve. And I'll start with you, President Murphy, because I think you're already starting to talk about that. It's not just what would be taken off the bargaining table, but for your members, it would have a lot to do with the way they work as well. So you want to start with that?
Thank you. That was such an interesting question. It really was. It's kind of, right. All of us are thinking, boy, if we could design our own system, I think it would be a system that worked for everyone. Tired workers who, were trying to fit in an overtime shift. It would work out for, you wouldn't have to do that. Our younger workers, who are getting out of school with a lot of debt and trying to plan a future, it would give them a different outlook. Union workers valiantly trying to improve working conditions in every single union could keep on working for these improvements and benefits instead of fighting, as we've talked about, to keep these premiums low. It would be a system based on prevention. You'd go to the dentist twice a year. You'd get an annual eye exam and a physical, and you'd be able to prevent these illnesses which are ending lives. If you were new to this country, you could get the care that you needed. That's available in so many other countries. And it would be hospitals being able to hire more frontline workers and at the bedside rather than funding an entire finance department. Those were kind of things that came off the top of my head.
That sounds like a great system. How about you, VP Ramirez?
Well, I think that knowing that, the culture that we have created now where people don't go to the doctor unless it's extremely necessary, I think I would change that. I notice that now when I go to the doctor, they say, you need to come back in 6 months or 3 months, but we'll remind you. And they do that, and they send me a reminder that it's time for your eye checkup or whatever they need. I think that's a good system. I would have, because it will be hard to change. Because even now, people who have insurance sometimes they don't go to the doctor because they don't want to stop working. So they have to go on the weekend or when they're off. I think if we're gonna design a plan, is you need to go to the doctor, you go to the doctor. During COVID, people got time to go get your shot and got paid to do that.
Mhm.
I think that imagine if the employee could go to the doctor even during working hours and get paid, not look down because you're missing work. I think that is important because and for some people who are covered with insurance, they don't go because they can't live off.
Right.
They don't have time to go to work. So I would make sure that people who got paid to go to the doctor, I would make sure that people got called and reminded that they should go to the doctor, because I agree with Katie. Preventive health, it's the answer to this high cost that we have now. At the end of sometimes as time goes by, and then everything is so expensive because now you're really your situation is so bad that it only by putting so much money into it. So I think that would solve some of the issues. And yeah, so that's what came up, with this question. But I think there's some things that we can really do to make it better.
I like that.
Yeah, I love that answer. Thank you so much. It's kind of the same thing as not voting because you've got to take time off from
Right.
work to go,
That's right.
right?
Right.
So
Exactly.
a lot of ways that we could use that. And how about you, Secretary Treasurer Hooker, and maybe also some other things that you could do at the bargaining table if healthcare wasn't your biggest priority?
Well, just being on this call demonstrates what could happen if if the working class comes together.
Yep.
I mean, you see, all three of us come from different backgrounds. We're in different professions. You have a school teacher, a nurse, and a truck driver.
Yep.
We're all talking about the same thing:
Yep.
how we can work together
Yep.
to strengthen the working class. We need to take this and just magnify it around this country, and then you'll see that change. And to the second part of your question, we could get a lot more for our members if we just take off
Yep.
the healthcare, pension contributions, high wages, like more sick and personal time off,
Yep.
paternal leave,
Yes.
all these great things that we could do by just making one change to benefit the working class of America.
Yep. Yep.
All of us standing together, doesn't matter where you come from, what you look like, all of us talking about the same thing on this call. And that just has to be sprinkled over every crevice of this country. And I think we can get there.
Very well said. Thank you. Anything any of you would like to add? Well, then I'm gonna thank you all for this very valuable discussion. And many thanks to Healthcare Now and the Labor Campaign for Single Payer for inviting us. And thanks to all the conference attendees who joined tonight to listen. Thank you and good night.
Thank you all. Thanks,
Thank you.
Catherine and Richard and Juan. This was wonderful. I'm gonna steal all your ideas, just so you know.
No, it was really terrific. I just want to thank each of you again. I really enjoyed the discussion, and I think it's going to we'll try to get it out as broadly as we can. we're trying to reach with the podcast, we're trying to reach rank and file and local
Yeah.
union leadership and really, help them to understand and counter a lot of the bad information that they are hearing out there. So you guys just did a fantastic job. Thank you.
Thank you.
Thank you. It was wonderful.
One union, one family.
Yes.
That's it.
Yeah,
Yes.
Nice talking to all of
Absolutely.
you. Yeah.
exactly. Yeah.
Thank you
Thanks
all.
a lot.